What a great way to start, right? I think we are all energized, yes. And importantly, I think the message is that we all need to work together to elevate the visibility and the momentum of this particular area. And that's what we're all here for. As I said, at IOM, we're committed to working with all of you. And I know all of you are also committed. As at the closing, I'm going to show you so many statements made by many of you of willingness to move forward together. And this is truly encouraging. So as you heard from Senator Warner and Collins, of course, how important it is to have inspirational leader. And of course, Atul Gawande is one such individual. I was saying to Atul, you know, my wife was reading his book. She couldn't put it down. She was telling me, you know, you ought to do this, you got to do that. I said, did you read our report? So I gave, it's a true story. I gave her the report. I haven't tested her yet to see how much she read. But you know, Atul I've known from the Brigham, because as you know, I spent many years of my life there. And you know, he's a surgeon, but amazing. And I don't mean in any derogatory term, but the fact is, not only does he operate, but he is such a thought leader, and he has such a way of putting important issues to the public, to all of us, and inspire us. He's a professor at surgery, but also Department of Health Policy and Management at Harvard School of Public Health. And of course, he's executive director of this initiative called Ariad. You know, actually, I know Ariad because I sent my team to spend time with him. When I was at Duke, I started an institute called Health Innovation. Immediately, I heard about you know, Atul's initiative, and we sent a team to learn how to do this. Because in many ways, innovation and the ability to get people together to apply new ideas to an unmet need or problem is where we need to be, and he's done a great job working in that environment as well. You know, he's also chairman of Lifebox, a nonprofit making surgery safer globally. We certainly know about the checklist, don't we? So he's won 2 National Magazine Award, Academy Health Impact Award for the highest research impact on healthcare, MacArthur Fellowship, and Lewis Thomas Award for writing about science. He's been a staff writer for New Yorker magazine since 1998, has written for New York Times bestsellers, The Complications, and of course, a finalist for National Book Award of 2002, Better, one of the 10 best books for 2007 by Amazon.com. And you know what, I could be reading this, but I'll just point out to you about Being Mortal, Medicine That Matters in the End, which was released in 2014, which of you know is an incredible book, great bestseller, and giving people really insight on the issues that we care so much about. I had the pleasure of on a panel with Atul, well, I think it was in November in Boston, and I can really see not only is he revered locally, but everywhere, and the work that he does is so important. When the senator says you need to elevate the visibility of this field, he's in fact one of the people who's helping us do that. So we're so glad he can find the time. I know he's a highly sought after speaker, but I know he knows how important this is. And so we're so glad that you're here. Atul, come on up.
Thank you, Sue.